Good morning, everyone. Thanks for braving the cold weather and coming out this morning. Originally, Dr. Bree Chouinard was going to talk this morning about her research, but both her and her daughter have come down with some kind of cold, so she didn't feel like she could come in and give her presentation because she's also 7 months pregnant. So I said, don't worry, I have a presentation that I'd be happy to give in your place. So my name is Lori Sacrey, and I'm going to be presenting on some of the work that I've been doing at the Autism Research Center. So let's get started. So today I'm going to talk about the developmental trajectories of early behavior in autism, and specifically I'm going to be focusing more on the parent reports and things like that, because that's the work I'm really interested in. So some of the things that I hope you'll learn by the end of my presentation today are what assessments did I use to identify autism before the age of 2? How good were these assessments at identifying autism-related signs? And how do parent reports of signs of autism compare to clinical ratings of those same behaviors? So autism is defined by impairments in social communication and the presence of repetitive behavior or restricted interest. With autism, though, it's frequently undiagnosed until age 4 or later. And this can be a bit of a problem because being diagnosed later, it's hard to know kind of what autism looks like as a child is growing up. So one of the ways that we do this is to look at retrospective reports. And retrospective studies often note that parents report concerns as early as 12 and 18 months of age. So they'll recall when my child was 12, they weren't really saying words yet. When my child was 18 months, they weren't really saying words with. And the most commonly reported difficulties were communication and social difficulties, which are not that surprising because those are kind of the hallmarks of autism. But these retrospective studies can be influenced by parental biases. So if you're thinking about, well, I'm trying to tell them about when my child had autism, I'm probably going to try to remember the things that are most linked with autism. And sometimes you might not think of things that aren't necessarily social or communicated related. So one of the ways to get around this is to look at prospective studies. So a lot of research has shown that the younger siblings of children diagnosed with autism have a higher likelihood of also being diagnosed with autism themselves. Some reports as high as 18%. So in order to understand a good way to understand how autism looks like as it's developing in young children is to look at these younger siblings of children who are diagnosed with autism and see what they look like as they're developing, because a percentage of them will have autism, and then you can go back and kind of look at what was going on in these children. So this was the purpose of the Canadian Infant Sibling Study. So it's a multi-site study across Canada, of which the Autism Research Center is a part. And what we look at is high-risk children. So these are the younger siblings of children diagnosed with autism. And we call them higher risk because they're at a higher risk of being diagnosed with autism compared to a community sample of children that don't have a family history of autism, which we call lower risk because they are at the community rate, which is about 1%. So there's a couple main goals of this study, and one of the main ones really was to identify what autism looks like as it's developing in the young child. But we also wanted to look at recurrence rates in families, so how many children with autism will also have younger siblings who are diagnosed with autism. We wanted to understand the core mechanisms of autism. If we could figure out kind of what it looks like as it's developing, can we kind of figure out what's going on there? And then to look at the efficacy of early intervention. So one of the programs that we recently are just almost wrapping up is Social ABC. So that's one of the early intervention that this group was also involved in. So the Canadian Infant Sibling Study, the main co-PIs were Dr. Zwagenbaum and Dr. Susan Bryson, but it was also included researchers from different sites across Canada. So in Toronto, we have Dr. Jess Bryan and Dr. Wendy Roberts. In Halifax, we had Dr. Isabel Smith. And in Toronto, we also had Dr. Peter Satmari. And there was about 900 families participating in this research, and about 600 of those were families with a history of autism, so are high-risk families. So this is kind of what all of the studies I'm going to present. This is the general methodology. So you start out with two groups, the high-risk group, or the younger siblings of kids with autism, and the low-risk group, or the young children who do not have a family history of autism. And we asked them to come into our research center, and we had them come in at 6, 9, 12, 15, 18, 24, and 36 months of age. Of course, some of them didn't come for all those appointments, some of them did, so we just wanted to try to get them as many times as we could for each of those time points. And we were looking at a variety of different things, so we're measuring cognition and their language, we're looking at signs of autism, we're looking at their adaptive behavior, we're also interested in temperament, and looking at parent reports of concern for autism. And then at 36 months of age, all the children, including the high risk and the low risk, underwent a blind diagnostic assessment for autism. So we've got a psychologist who had never seen these kids before come in and do an ADOS with them and then give their best clinical estimate on whether they thought that child met the criteria for autism or not. So there are 3 studies that I want to talk to you about today. First, I want to look at the parent reports of concerns regarding meeting developmental, motor, social milestones. So I'm going to look at the parent concern form. Then I want to tell you a little bit about how the parents were reported on the violent adaptive behavior scales. And then in the end, I wanted to talk to you about the Autism Parent Screen for Infants, which is a questionnaire that was developed by our group to see how efficacious it was at identifying young children with autism. So can parent concerns flag autism? So this study was really interested in looking at if we asked parents at each of those time points when they came in, if they had any current concerns about their child, how good was this questionnaire or this semi-structured interview at actually picking up these differences between the children. So we collected these at the different time points between 6 and 36 months of age. We asked specific questions to address several different developmental areas, and we included a low-risk comparison group. And we did all of these things because previous studies who look at parent concerns usually didn't have a low-risk group or only really asked about one thing like social development or communication, and it was really mostly done at a single time point, 12 months or 18 months. So we wanted to be a lot more inclusive of all of these things. So this is a look at what our parent concern form looks like and the types of questions it asks. So we covered 10 domains of development. We'd ask them how their child is sleeping. Do they have difficulty settling? How many times a night do they wake? We asked them about their diet. So are there any concerns about eating habits, the types of foods that they eat, the types of foods that they won't eat? Then we also looked at sensory things. Does your child have any sensory sensitivities, lights, fans, sounds, textures, those types of things? In addition, we asked about gross and fine motor, how they thought their child was doing, and as well as the repetitive movements that are kind of hallmarks of autism. We also asked about the types of language and verbal and nonverbal gestures that they use, if they'd ever had language that now they no longer use, or gestures that they no longer use. And we asked them about social skills. So how does your child interact? Are you concerned about how they play with their peers and the types of play that they do? So when they play with toys, how do they play with their toys? And then the final thing we asked them about is their behavior. So this is looking more specifically at temperament and ability to settle and being okay with transitions and things like that. So I'm going to take you each through these developmental domains and tell you how our parents reported these concerns. So first we have sleep, and all of my graphs that I'm going to show you will look like this. So on the top right, I have just the group effect collapse for time. So were the groups different? And then you can see on the bottom, I have the group by time interaction. So how the parents scored at each of the time point. And you can see that on the y-axis, I have the percentage of concerns reported. So if it was 0%, it meant no parents at this time point reported this concern. And if you're at 100%, it means every parent in that group reported that concern. And then across the bottom there, you can see I've got the age in months. And my groups here, for the low-risk kids who weren't diagnosed with autism, they're always going to be in blue. And then I have my 2 high-risk groups. So at 36 months of age, they were either meeting criteria for autism or not. So I like to remember this as thinking like the high-risk kids that did not meet criteria for autism are stop for autism. So they're my red group. And then the high-risk children who did meet criteria for autism were like go for autism. So they're my green group. So that's kind of how I keep them separate when I look at the graph. So here is what we found when I looked at the sleep reports. So there was generally a difference between the high-risk versus the low-risk group. So the parents of the high-risk children all reported sleep difficulties compared to parents of low-risk children, but there was no difference between the parents of children who were diagnosed versus who were not diagnosed. And when we look at the interaction by time, you can see that again, the sleep reports of sleep concerns were not different between the high-risk parents of children who would be diagnosed with autism versus who would not. And we found similar things with diet. In fact, we found that parents, no matter what group we ended up placing their child in when they were 3, showed no differences in reporting concerns. So parents of children who were diagnosed with autism did not report more diet concerns. They didn't report more that their children were picky eaters. And this may partially be due to the age of the children. So these reports were collected until 3 years of age. So perhaps these children wouldn't develop differences in eating until they were a bit older. So when we look at these two sections, we were kind of like, oh no, this is not going the way we hoped. So, but when we got to the next one, that's when we started to find real differences. So when we look at the presence of sensory concerns, you can see that parents of the children who were diagnosed with autism reported a lot more sensory concerns than the low-risk parents, and as well as the parents of high-risk children who were not diagnosed with autism. And you can see on the bottom graph down there that these differences were apparent across all of the ages that we measure. So the parents of children with autism were significantly reporting more more sensory concerns than the parents of the other two groups. And when we look at motor concerns, again, the parents of the children with autism were reporting significantly more motor concerns than the parents of the other two groups. And you can see that this stayed fairly consistent across time, with the parents of the children with autism reporting more concerns at 6 months of age. So this may be that their child isn't rolling over yet, or their child isn't sitting on their own. And then again, at 18 and 24 months of age, this would be things like, my child is not walking yet, or my child is not able to grasp things using a pincer grasp. For language concerns, we found kind of a gradient here. So the parents of children with autism were reporting significantly more language concerns than the other two parents. But the parents of the high-risk children who were not diagnosed with autism were reporting more language concerns than the children who were from the low-risk families. And you can see on the bottom graph that the differences really began to emerge for the high-risk group with autism at about 15 to 18 months of age. And when we look at language loss, because that's one of the things that has been studied before, so if your child had a word or a gesture that they used to say and now are no longer saying, we found that overall most parents didn't report any concerns. You can see it's about the high-risk ASD group is about 5%, if that. But we did find a significant difference at 24 months of age. So it may have been that a few parents reported their child used to say a word that now they're no longer saying. And when we looked at the presence of social concerns here, we find that the parents of children with autism, again, were reporting a lot more concerns than the parents of our other two groups. And this was apparent, again, at 12 months of age or later. And when we looked at how their child plays with toys, again, we find similar things. The parents of children with autism were reporting significantly more play concerns with how their children play with their toys than the other two groups. And you can see that this was evident across many of the different ages that we looked at, starting at 9 months of age. And for the presence of repetitive motor behaviors, we found kind of a gradient here as well. So the parents of children with autism were reporting more repetitive motor concerns, but the parents of high-risk children who did not have autism were also reporting a few more motor concerns. And that's in line with a different report that we did looking at having parents look at the repetitive behavior questionnaire. They found kind of a gradient there where the children with autism reported had more motor concerns. The children that did not have autism had kind of an in-between, and the low-risk children had fewer repetitive motor concerns than the high-risk kids. And finally, when we looked at the presence of these behavioral problems like temperamental and things like that, we found that overall, the parents of children with autism were reporting more problems with transitioning and things like that. But the group, when we look at it across time, these differences don't really fully emerge between the two high-risk groups until 24 months of age. So although they're different, when you look at it across time, it doesn't appear until a bit later. So to summarize kind of those findings there, we found that the core characteristics of autism, so the social impairments and the language and things like that, don't really differentiate between the two high-risk groups until after 12 months of age. So from the graphs, we could see that the differences between the two high-risk groups didn't appear till 12 months of age for social, 15 months of age for communication concerns, and 18 months of age for repetitive behaviors or restricted interests. But what was interesting is the so-called prodromal characteristics were able to differentiate between the two high-risk groups as early as 6 months of age. So these are the sensory and motor things. So kind of these parent reports kind of go in line with the development of infants. So the first things that children use to explore their worlds are sensory movements and motor movements. And so it makes sense that you would see impairments in these ones first. So this has been coming up a lot in the literature, and so sensory motor differences now are often being referred to as prodromal differences, or the things that appear first, basically. Parent concerns do provide valuable information about autism in infancy, because we can ask about things that are happening as they're happening, and we don't need to necessarily rely on retrospective reports. And as I mentioned, the sequencing of parent concerns also seems to reflect the developmental course of autism. So we see these early reports of the prodromal or sensory and motor features earlier, and then the concerns reporting more of the ASD core domains coming on later. And that makes sense, because that's when kids will be playing with other kids, or they'll start using their first words, is usually after the 1 year of age mark. And I was really proud of this paper because it was picked up as one of the top 10 autism research stories in 2015. So it was just really great to get kind of the spotlight on our research and showing that we value what parents have to say, and I'm really glad that this got reported out there. So the next study I wanted to talk about was the adaptive behaviors. So here we wanted to look at a different kind of reporting. So the Vineland Adaptive Behavior Scales is a structured questionnaire in which a interviewer asks a parent a series of questions to determine if the child can do a particular behavior or not. So this one specifically focused on children between 12 and 36 months of age, and we use the first version of the Vineland Adaptive Behavior Scales. It's on version 3 now, but this study started so long ago, about 15 years ago, that we had used consistent measures, so we used the Vineland one for all of this. And then, as we did in the previous study, when the children hit 3 years of age, they underwent a blind diagnostic assessment where we determined if they had met diagnostic criteria for autism or not. But another thing we did in this study that was a little bit different was within the high-risk group that were not diagnosed with autism, we looked at developmental characteristics of these children, because within the literature as well, there's a large portion of literature that suggests that the children who don't meet criteria for autism often have other developmental concerns that really may have other things, but just not enough to have autism. So we broke them up into these groups. So we have the high risk, which we would then call kind of typically developing because they were performing similar to typically developing children. And then we have the high risk group, which we call the broader autism phenotype, which means that they have other developmental problems, but not autism. So this is kind of the 4 domains of the Vineland. So it looks at communication, daily living skills, socialization, and motor skills. So the types of questions we would ask is, does your child understand the word no? Does your child say mama or dada? For daily living skills, we would ask things like, is your child able to feed themselves with a spoon? Can they talk on the phone? For socialization, we want to ask if they recognize emotions in others, they can transition between tasks. And for motor skills is basically asking different types of motor developmental. So can they crawl up the stairs on their own? Can they unwrap small objects and things like that? So for this analysis, what we used was, instead of looking at the data by groups, we looked at a data-driven approach. So what this does is a statistical analysis where you basically put all your data in a computer, and then it basically puts the kids in different trajectories. So you have 3 different trajectories. So you have the kids at the top who are performing average and are showing consistent gains over time. Then you have the group in the middle, which is doing pretty well, but they're not making as many gains as the top group. And then we have the low trajectory. So they start off a little bit lower and they actually don't make any gains over time. So what we can see here is when we look at the total number of participants, irrespective of what their developmental outcome was, we have about 21% of them going into this low adaptive behavior trajectory, 53% going in this medium trajectory, and then the high trajectory of kids who are doing really well are 26% of them. When we look at what the proportion of our participants are in each group, what you can see when you look at the bottom at the low group, about 57% of our children with autism are in this low group, but only 5% of children with autism are in the high trajectory. And when you look at the low risk group, you can see that only 3% of them are in the low trajectory, whereas 38% of them are in the high trajectory. And you can see that for the most part, the majority of kids are all in this medium trajectory, apart from the children with autism, where there's about a third of them in there. So it's a good way to look at not just what the group is doing, but where kind of kids in each group fall within it. So just because someone has autism doesn't mean that they can't be in the high trajectory, and that's a good way to look at this. When I'm looking at the scales themselves, so looking at the differences by actually comparing them by group, we have the scores here for communication. So the higher the score, the better the performance on this scale, and the age across the bottom. And the kids with autism, again, are green. The high-risk kids that were typically developing are in red, and our low-risk kids are again in blue. And then that group of high-risk kids who didn't meet criteria for autism, but maybe did for some other developmental delays, are in this kind of bluish, light blue color. And what you can see is that the high-risk ASD group and this broader autism phenotype group are performing not as well as the other 2 groups on communication, so they're saying less words or maybe not understanding as many words. So we can see that the autism group and the broader autism phenotype group are not different from each other, but they're both different from the so-called typical groups. And the similar pattern for daily living. So what you can see, the higher the score again here, the better. And you can see that again, the high-risk ASD group and the high-risk broader autism phenotype group are not different from each other, but they're both different from the typical developing groups. Similar again for socialization. So their parents are endorsing fewer skills on socialization than the parents of the typically developing groups. For motor, it's a little bit different, but the children who are showing some developmental differences our parents are endorsing fewer questions than the parents of the typically developing group, but at 36 months of age, we can see that the broader autism phenotype and the children with autism are showing less motor ability than the children of the typically developing groups. And so this is a composite, so it looks at all the scales and gives you an overall score on it. So the higher the score, the more adaptive behavior the child has. And what you can see here, again, similar with the patterns, is that the two groups of children that either have autism or other developmental concerns are showing less adaptive behavior than the children in the other two typically developing groups. And this was apparent across the 4 time points that we looked at, starting at 12 months and going to age 3. This graph is a little bit different because it's actually showing age equivalence. So the higher the age equivalence, the better the performance of the child. So you can see that they start out kind of in a similar spot at 12 months of age, but as they get older, you can see that the children in the 2 developmentally concerning groups are performing less well or at lower age equivalency than the other 2 groups. So you can see they kind of start out the same here. Then by 24 months of age, we're already seeing this kind of division in skill ability. And then by age 3, you can see that the children in the typically developing groups are performing above age equivalent levels, whereas the children in the 2 concerning groups are performing lower than what they should be by age equivalent. So they're performing at about a 30-month level compared to a 36-month level. So what did this information tell us? Well, adaptive behaviors are able to tell us valuable information about autism, but it's not specific enough to be able to differentiate between autism and other developmental delays. So the high-risk kids that didn't have any concerns are a high-risk typical group, and our low-risk kids were not different from each other. So it's not really an autism-specific assessment, but it is able to provide valuable information about adaptive behaviors and things like that. So finally, the last study I want to tell you about is our parent questionnaire that we developed in the lab, so the Autism Parent Scale for Infants. And so we wanted to determine if this questionnaire was able to help us predict which children would end up being diagnosed with autism from those that wouldn't. One of the nice things about Parent Report that I should have mentioned before but I didn't, is that parents spend so much time with their children that they see them across all these varied contexts. They see them with family, they see them with friends, they see them meeting strangers, so they have a good grasp of what their children will do in different types of situations. So the APSI itself is a questionnaire made up of 26 questions, and it queries things that are generally thought of to be associated with autism. So does your child respond when you call their name? Does your child engage in back and forth vocalizations? Does your child make eye contact with you? Does your child show repetitive behaviors, unusual sensory interests? And does your child point to objects? But it also asks about things that sometimes are not really thought to be associated with autism. So can your child visually track a moving object? Does your child imitate actions and sounds? Does your child coordinate actions with what they're looking at? Is your child overreactive or underreactive? Is your child difficult to soothe? Does your child show gestures and things like that? So it covers a wide variety of behaviors, which I think is really great. So what happened? So we, again, got the parents to complete this questionnaire at the different ages from 6 and 24 months of age. And then we compared the scores on them by the 3 groups at outcomes. So we have the low-risk group in blue, the high-risk group that were not diagnosed with autism in red, and the high-risk group that were diagnosed with autism in green. And the higher the score on the y-axis, the more poor the performance, I guess you could say. So the lower the score would mean the presence of no symptoms, the higher the score would mean the presence of more symptoms. And we have the age across the x-axis on the bottom. And what I think you can see right away is that the parents of children who were diagnosed with autism consistently across every age where we had them fill out this questionnaire reported more concerns than the parents of the children in the other 2 groups. And this was apparent right from 6 months of age, which was really surprising. So to show you kind of where the differences between the 2 high-risk groups lie, because that's what we're interested in, is trying to determine if we can differentiate which younger siblings of the high-risk group will end up being diagnosed with autism versus those that won't. So when we looked specifically at 6 months, there was 2 items that was able to statistically tell the difference between which children would be diagnosed with autism versus which one. And what's interesting is one of them was the visual tracking of moving objects. So this would be kind of one of those sensory concerns that parents would identify. And then the other one was engaging in vocalizations back and forth, so babbling and things like that. When we looked at 12 months of age, there were 14 questions of the 26 that was able to differentiate between the 2 high-risk groups, so a nice variety of different behaviors. But then by 18 months, 21 of the 26 items were showing significant differences between the 2 high-risk groups, which I think is really interesting and really important to know. So the APSI, this questionnaire, the Autism Parent Screen for Infants, is definitely able to differentiate between which high-risk sibling will be diagnosed with autism versus those that will not meet the criteria for autism at 6 months of age. And although there are several screeners that are available, so you're probably aware of the MCHAT and things like that, the APSI could fulfill a unique role because it's informative as early as 6 months of age. It's not expensive, and it can work as a standalone screener. So things like the MCHAT, when you flag as meeting criteria, often you need to follow up with an interview to determine some of those concerns, whereas this one doesn't seem to need that one necessarily. So the APSI shows promise because it's simple, it's low cost, and it's a great way to report concerns as a parent, and it's really quick to fill out. Although it's 26 items, it's yes, no, maybe, and it takes at most 10 minutes to fill out, I think. So that's great, but how do these parent concerns stack up to other clinical completed measures? So if parents are reporting these things and we're going through all the effort to get what parents see, does it make a difference if the clinicians are also seeing all these things? So I was also interested in looking at how we compare. So are parents picking up things that maybe clinicians are missing, or are clinicians picking up things that even parents are missing? So I wanted to look at 3 different things here because these are things that I could pull out of our clinical assessments for comparison purposes. So when I look at motor development, you can see at the top we have the parent concerns and the VABs, or the violence. So this is just to remind you where the group differences lie. And when I looked at the AOZ, which is our early infants, so it's kind of like a really early ADOS, but don't tell Lonnie I said that. So it's the Autism Observation Scale for Infants. So it is able to see motor differences between children in the high-risk group who will meet criteria for autism versus won't at 6 and 9 months of age. And then it disappears after that. Whereas you can see with our parent concerns, it's showing it at 6 months of age as well, but also noting differences later on. And this is probably because the AOZ really just focuses on hand-eye movement and trunk control, whereas the parent concerns asks about anything at all motor related. When we looked at the Mullen Gross Motor Scale for the kids that completed the parent concerns, those ones that we put in to see if they show differences on the Mullen, we didn't find any differences between the 3 groups, which is surprising. So when we look at sensory behaviors, to remind you, we found differences across all the time points in our parent concern group. And the only one that really asked specifically about sensory stuff was, again, this early assessment, the Autism Observation Scale for Infants. And it wasn't really noticing sensory differences, or it wasn't identifying sensory differences until 18 months of age. So you can see before that, they're really flat curves, and then at 18 months of age, I guess that's when children really start to do more sensory exploration of objects. So the parent concerns asked about any kind of sensory things, whereas the AOZ is looking specifically for kind of touching objects or things like that. And it has to occur within this little 12 to 15 minute assessment. So it's possible to miss that, because if the child does it at home, the parent will report it. But if the child doesn't do it in this little 15-minute assessment, it doesn't get coded, right? So it gets missed. And finally, we have the language development. So parent concerns, you can see that at 15 and 18 months, the groups were showing differences. But these same kids, when we looked at them on the expressive scale of the Mullen, which is like a developmental assessment, we weren't finding any differences between the 3 groups. Although it looked like the low-risk group was showing better language, statistically wise, they were not actually different, which was surprising. So, after all of this information, what I hope you've learned is that Parent Report can provide really valuable information about atypical development of infants, even before such impairments can show up on structured developmental measures. So sometimes they show up at the same time, sometimes they don't. And as I mentioned, if you're just doing an assessment that's about 15 minutes long, if the child just doesn't do a behavior during that 15 minutes, it's not going to get coded. Whereas if the child does it at home, the parents will see it and they can report it. So that's one really nice thing about gathering information from parents. What assessments can we use to identify autism before age 2? Well, a really good source of early information, of course, is the parents themselves. So we just ask them, is there anything you're currently concerned about? And often when you do that, parents will say one or two things, but if you probe them about more specific things, they often give a lot more information. So at the start of that parent interview that I said, our very first question is, do you have anything you want to tell us about concerning you today? And sometimes parents will say, no, not really. And then we start getting into the specifics, and then let's say, oh, you're right, yeah, they're not doing this yet, or they're not doing this yet. So actually probing them about the developmental domains seems to help them remember that they have concerns about certain things. So how good are they at identifying autism-related signs? Well, parents appear to be quite good. So on all of these 3 studies that I just showed you, they were all based on parent report, either through semi-structured interview, a structured interview, or just a parent report questionnaire. They were all quite good at differentiating between the children who would be diagnosed with autism versus those who would not. And that's what's really good about using the study design, is because within that high-risk group, we have the parents of children who are diagnosed with autism, but we also have the parents of children who are not diagnosed with autism. And all of these high-risk parents have at least one child with autism, which helps, in a way, kind of control for parents maybe over-reporting or under-reporting because they maybe are not sure what autism is or things like that. So it's a good way to control for over-reporting or under-reporting because they all have experience with autism. And so how do parent reports compare to clinical ratings of autism-related behavior? Parents appear to be surprisingly worse, so they're able to see things and maybe notice things that are being missed in clinical assessments. And I don't think that this is necessarily anything to do with the ability of the clinician or the clinical measures, but perhaps the amount of time that the clinician has to spend with each child. So as I mentioned, the parents see their child all the time across different contexts, so they understand how their child is going to behave and react, whereas the clinician really just sees them during their appointment. So if the child behaves really well that day, they might not see anything, or if the child just doesn't do certain things that the parent sees them do, then that's going to get missed as well. So I think that's what parents are a really good source of information for these early concerns. So I want to thank you all for coming out and braving the weather today, and I want to acknowledge all the people that were involved in this study because it was across 3 sites and it was 15 years long worth of data here. And of course, I'm just presenting it, but I didn't do it all alone at all. So I want to acknowledge all of these people, and I want to thank you for coming, and I would be happy to answer any questions you may have about any of these things. Thank you. Yes?
When you presented the data on the Vineland about the motor abilities, it looked like you couldn't diagnose motor concerns until 36 months, yet those are supposed to be the pre-modal, right? So isn't the Vineland doing a particularly bad job at motor?
I think that the Vineland, perhaps the way the old, so we're using the old version of the Vineland, so it wouldn't include a lot of the new things that kids are doing now. So for example, the Vineland 1 doesn't ask anything about smartphones or anything like that, whereas the Vineland 3 does now do that. So I think some of the questions are a little bit older. And I mean, the Vineland isn't meant for autism. It's just meant for adaptive behavior. So it's not autism specific in any way. But I agree with respect to what we would want to use it for, which is to help us to identify autism, at least within the sample that completed it here, it was not doing a great job of picking that up. You're right. Okay, well, if there are no other questions, then thank you for coming. And if anything comes up, please feel free to email me. I'm also the person that sends out all the rounds emails, so you should all have my email. Thank you. Have a great day.